Sandhya Rani. I work as Senior Consultant Obstetrics and Gynaecology Department, Aster Women and Children Hospital, Whitefield, Bangalore. So today I'm here to discuss about a very common hormonal imbalance which women go through. It's called the polycystic ovaries or PCOD or PCO. It goes by many terms and everyone uses it very interchangeably. But what exactly is polycystic ovaries? So PCOS, as we call it, is a genetic problem. It's an endocrinological problem and it's a lifestyle problem. So to summarize it, it starts with a genetic background. So if you have that gene, then it shows up sometime in your life. It's a lifestyle problem because it shows up when you have a bad lifestyle. And it's an endocrinological problem because the outcome or the results of that problem show up as hormonal imbalances. So what age group can have polycystic ovaries? So it can happen in any age group. It can start in your teenage, it can go through the middle age, and we have women about 40-45 also presenting to us with the same hormonal changes. So how do we detect it? So whenever we suspect, so how do we suspect? When a woman comes to us or a girl is brought to us with some menstrual irregularities. So usually delayed periods or frequent periods, or it could be scanty periods, that is the flow being less than the usual. So is only irregular periods the symptom? No, we have certain criteria. So along with these menstrual problems, there have to be certain hormonological changes. Especially the male hormone in the body of the woman increases in amount, which may result in excessive facial hair growth or hair loss at specific areas. We call it as male type of balding. Or we don't have any of these symptoms, but when we get a blood test done, there it shows excessive male hormones. And finally, the ultrasound. Ultrasound is not taken as a very strict criteria because if we get an ultrasound done for 100 women, 50% of them will have the picture like polycystic ovaries. So just by seeing an ultrasound, we do not diagnose polycystic ovaries. It has to be a combination of all these symptoms. So when you come to us, we assess your general health condition. We take your body mass index because that is very important. Then we take your vital parameters and medical history, and basing on our assessment, we would be asking for certain blood tests. So these blood tests would include the hormones like FSH, LH. We would also like to exclude thyroid problems, so there would be a thyroid test done. There's this male hormone called testosterone which is assessed. And there are certain other situations which seem like polycystic ovaries and could mislead us, so we'll try to exclude them through other blood tests. So once we conclude that this person or this lady has polycystic ovaries, what is the next step? So it is not a blanket treatment for everyone depending on the age group and the requirement. We tailor-make the treatment. So if it is a young girl in her teenage, so honestly polycystic ovaries is never diagnosed in young girls, because their ovaries will seem like that. Menstrual abnormalities are expected. So maybe when she's in her late teens, around 18, 19, and still the periods have not got better, that is when we start thinking of polycystic ovaries. So that's the age group where lifestyle, stress management and all are spoken to about. Unless the girl has lot of acne or lot of facial hair growth which is causing social embarrassment to her, we do not think of hormones in this age group. We try to correct her lifestyle, we give them vitamin supplements, we ask them to take all the hygiene precautions and see how the result goes. We go a little slow with the treatment. So in the early 20s, where women are early into the career and have this, again we go slow with the treatment depending on what specific problem they come to. So if it is mild hormonal imbalance, few menstrual irregularities, we still go with the lifestyle correction only. If it is a woman who's newly married or who's married for some time, planning for pregnancy but unable to conceive, the evaluation will be different, because there we would also think of certain fact situations called insulin resistance, which puts them at a risk of diabetes. So we check for insulin resistance, and if it comes as positive, we put them on some medicines which will lower the insulin resistance. There are certain proteins and compounds which will lower the insulin resistance. So if a person comes to us with some fertility requirement, they're planning for a pregnancy, unable to conceive, the treatment goes a little faster and a little aggressive. But at the background of all this, the first line is always the lifestyle correction. Again, if it is a woman who has completed her childbirth, she is in her late 30s and comes to us with PCOS, there's a different category of treatment altogether. So there are hormonal pills, there are non-hormonal pills, there are vitamins, there are protein supplements. All of these in different combinations are given to the women to help them regularize the period, cope up with the skin and hair conditions they have come to us, and have a normal stress-free life. PCOD and diabetes have the same gene. So women who have polycystic ovaries, once they get pregnant, are at high risk for getting diabetes during pregnancy, and they carry a lifetime risk of getting diabetes early on in their life. Like others, if we expect them to have it around 45-50, these would be 10 years earlier. So we counsel them that you have a risk for diabetes as well. So maintaining their ideal body mass index, eating the right kind of food and exercise is always important. So to summarize, once you are labeled as PCOD, you need to understand that this is a lifestyle issue. So even if you have the genes in you, if you carry forward with a good lifestyle, you can always avoid the problems and symptoms. Hope this helps you understand what is polycystic ovaries and what to do if you are diagnosed with one. Thank you.